I'm Dr. Kayla Borchers, a board-certified orthopedic clinical specialist in physical therapy, as well as a pregnancy and postpartum corrective exercise specialist. Combining these two worlds to help women feel their best throughout pregnancy and afterwards is really my passion here. So today's video is all about supporting your body through pregnancy. I've had many women reach out to me that as their baby grows, they start to notice the onset of back pain or pelvic floor pain or hip pain. And so how can we optimally support the core and the pelvic floor as our baby grows? So that's what today's video is all about. Today's video is safe for women at any point during pregnancy, so long as you do not have any extra precautions or contraindications from your healthcare provider. So always check with your individualized healthcare provider before engaging in any new kind of activity, just to make sure it's safe for you personally. But there are no restrictions as we move today in regards to, this is only for women in their first trimester or second trimester versus third. I've made this flow, today's routine, to really speak across all trimesters. So wherever you are in your journey, thanks for joining us today. Let's get moving. We'll start on all fours, so on your hands and your knees. This is one of my favorite positions to work in during pregnancy because it allows that growing belly to have room to do just that, to grow. So we're going to start with 360-degree breathing. Now what that means is that we're not just going to breathe into the belly. So a lot of time when we hear diaphragmatic breathing, people just go straight to letting the belly pooch out and the belly come in. Now what that does is it doesn't allow the full core canister to appropriately manage pressure. So when you breathe in, you want to get expansion through the front, but also through the side ribs and the back. Let's go ahead and practice that. So inhale, exhale. On the inhale, you should feel that 360-degree expansion, front, sides, and back. On the exhale, think about hugging baby up and in towards your spine. Inhale, expand. Exhale, hug baby up and in. Continue with this as I give a little bit more information here. So when you breathe in, think about a balloon expanding. A balloon expands through all directions, right? If it only expanded on one side and blew up as big as we wanted it to, that one side would eventually pop, right? So with our core canister, it really wraps all the way around, and we want that expansion all the way through, just like a balloon, so that we're managing pressure all throughout. If we ask only one area to expand, then that area eventually is going to have some signs of dysfunction, right? And not feel the best. So that is why we need to get that side and that back expansion. Go ahead and come off of your hands and your knees and take a comfortable seated position. You could just be kneeling like this, or you can put something on your bottom if this is too much of a knee bend. And I want you to put your hands on your side ribs. As you inhale, focus on pushing those hands away. As you exhale, let them sink in. So with this practice, we're really going to focus on that side rib expansion. Breathe in, breathe out. Breathe in. And exhale, let the hands just relax in. So seated is a great position to practice this, especially for the side ribs. Let's do one more. Inhale. And exhale. We're next going to go into a modified child's pose to really work on the back expansion. So my knees are wide. I want you to allow room for that belly to go between your legs. So knees are wide, you're sinking hips back towards heels, allowing the belly to fall between your thighs, and then hands walk in front of you. Forehead rests on the floor. Now if this is uncomfortable in your hips, or you feel like, it just doesn't feel the best, then you could modify here. So you could put your hands on something. So think maybe you have a couch or an ottoman here that your hands go on. so that we decrease the amount of hip flexion here. Or you could put something under your bum to, again, just kind of elevate and lift out of that and give the belly more room to fall towards the floor. So in this modification of child's pose, whatever way feels best for you, we're really going to focus on the back expansion, because here the front is anchored by our thighs, right? So we're limited on how much front expansion and side expansion we can get. So we really have to focus on getting that back expansion. So let's take a few breaths here. On the inhale, really focus on expanding or lifting through that back. And on the exhale, just relax. Let that tension go. Inhale, breathing into that back. Exhale, let it go. Inhale, expanding through that back. Exhale, let it go. Good. One more here. Inhale. And exhale. Awesome. So now we have our breathing down. We're going to come on to all fours, and we're going to add some movement in. So throughout, I want you to maintain the breath that we just practiced, really working on that 360 degrees of expansion. And then you're going to reach your arm up and down. Alternating arms, keeping that steady breath where we're hugging baby up and in on that exhale. So we're keeping it dynamic here. We're not just thinking about sucking that belly button up and in and just holding it there, right? Our breath really should be dynamic, and that core contraction, relaxation should be consistent too. So it's very adaptive to the load that we're putting on it, right? So you can stay here with the arms, or we can make it a little bit more challenging, and then we're going to do legs only. So I'm extending and bringing that leg in, opposite leg extends, bring it in. As I extend that leg, I'm tightening the buttocks of that side. So I'm extending left leg, tightening left glute, releasing on the lower, extending right leg, tightening right glute, releasing on the lower. Notice as I lift my legs, I'm keeping my core relatively neutral, my spine relatively neutral. I'm not arching my back to lift my leg up higher, right? We might see that in fitness videos and think it looks cool, but you're not getting any glute strengthening there. All you're doing is arching your back, compressing your back in order to make it look like you're moving the leg higher. So let's break that habit if it is one that you do typically, and really instead focusing on what you're activating and why you're activating it. So here we're tightening glute on the extension, relaxing glute as we lower it down, all the while maintaining that 360 degree breath, hugging baby up and in on the exhale, keeping core and spine nice and neutral. Okay, you can stay there, or we'll reach opposite arm and opposite leg. So again, this just makes it more challenging. Opposite arm, opposite leg, moving through here. And these videos are designed to give you the education, the why behind the what, right? So as you're moving through other exercises, you're thinking about these cues. You can see how at any point in pregnancy this is doable, right? And as baby grows, maybe it feels better just to move the arms, right? If we're days away from that due date, maybe it doesn't feel the best to do opposite arm, opposite leg. That's okay. And maybe it does, right? We're all different, and being okay with meeting ourselves where we are is what it's all about. Let's do one more on each side. Awesome. So another favorite position during pregnancy as we're working on strengthening our gluteals, our core, to help support our back during that growth of our baby, is side lying. So in side lying, I want you to lay with your pelvis stacked, so hips right on top of each other, knees slightly bent, ankles together. You're gonna rotate your top knee open for a pause, and then slow controlled lower. Now this motion, you could absolutely add a resistance band to, if you have one on hand. 10 to 15 reps here is what I typically recommend. So if you're feeling it with 10 to 15 reps here, then you can keep it without a resistance band. If you're like, I'm flying through this with 15 reps, then let's add some resistance on. If you don't have a resistance band, you could also add like an ankle weight here. You just want to make sure as you're doing that, you're not compensating by rotating the whole pelvis back, rotating the whole thing back. That is cheating, okay? You're using other muscles to get the job done, but when we keep that pelvis stacked, you should feel a nice muscle burn in that back pocket area. Very good. Let's straighten our top leg. We'll stay on this side. You're gonna turn your toes slightly down and lift the leg up and down. So we're staying on the same side. We're lifting our top leg, toes are angled slightly down, side lying leg lift. So this is targeting those side glute muscles. These muscles help our pelvis stay level when you're doing any kind of single leg activities like stair climbing or jogging or hopping. So super important, especially as we respond to the growth of that baby and as we prepare those muscles to support our bodies postpartum as well. Good, so now we're gonna straighten the bottom leg, top foot comes up and over. You're gonna lift your bottom leg up and down. So this is getting those inner thigh muscles, those adductors, which attach directly to that pelvis. So wanting to support the pelvis both by working the muscles on the inner attachment area as well as the outer. We've also gotten our core, that 360-degree core, as well as our gluteus maximus, that primary glute muscle that extends the leg straight back when we were on our hands and our knees. So really hitting a full picture with today's video. Awesome, let's go ahead and flip sides. So we'll do all three of those now on the other side. So starting with those knees bent for our clamshell. You should feel this in that back pocket area. If you feel a burning sensation, that is a good thing. If you feel some muscles quivering or shaking, that's also a good thing. That means we are getting some muscle change to occur. We're using the right area. Again, if this feels super easy, check in with yourself first. Make sure you're not compensating by rolling the whole pelvis back. If so, then you're just using momentum to get the job done, right? This pelvis should stay stacked. Hip bones are right on top of each other. I'm just rotating that top knee open, so getting that hip external rotation. Pause, feel that burn. Slow, controlled release. We're not just letting the leg plop down. We're not letting gravity take over. We're controlling that descent against gravity. Let's do 2 more on this side. And then we'll go into that side lying leg lift. So now our top leg straightens, toes point slightly down, and we're lifting that top leg. So you might be asking yourself, why do I have to point my toes slightly down? Naturally, I want to point my toes up. I can move much further. That's true, you can move much further whenever you point the toes up. However, you are compensating or using the front of your hip muscles to get that job done. Those front of your hip muscles are your hip flexors. And those muscles oftentimes like to take over for these side buttocks muscles or these side glute muscles. When we turn the toes down, we help make sure that the front of the hip muscles turn off, so those hip flexors are not able to help us get the job done here then. Now I really do have to use that side buttocks muscle to get the job done, which is our goal to strengthen here. So again, when you're doing exercises outside of this video, checking in with yourself. Are you lifting your toes up towards the ceiling just to look like you could move further? Or are you actually trying to strengthen your hip flexor or work on mobility? If so, okay, that's fine. But if your reason for doing this side lying leg lift is to strengthen your buttocks muscles, or your side glute or hip muscles, then you might want to check in with yourself and make sure that your toes are pointing straight down. Bring your top foot in front, bottom leg straightens, and we're getting that bottom leg lift. Ankles just relaxed here, whatever feels most comfortable for that foot. Getting the adductors or the inner thigh of this side now. Very good. Keeping that nice and steady breath, making sure that as you're exerting yourself, you don't all of a sudden start to hold that breath. Take it back to that 360-degree breathing we discussed at the start of this video. Let's do 2 more. Awesome, making your way up to seated. So we did some work in seated, working on our side rib expansion. We did some work on our hands and our knees, working on that 360-degree expansion, as well as core and glute strengthening. We were in child's pose, really working on the back expansion part of the breath. And then we were in side lying, working on your side glutes, as well as the inner thigh muscles. So really painting a nice full picture to support the pelvis and the back during pregnancy as the baby continues to grow. Thank you for being here. I'm Dr. Kayla. You can find me at drkaylaborchers.com, on Instagram at Dr. Kayla Borchers, and right here on YouTube, you can subscribe to my channel, Dr. Kayla Borchers. I am so glad you got some movement in today. Let me know if you have any questions